Welcome to Only for Seniors. I'm Dr. Eric John, a doctor who has dedicated his career to understanding the unique health needs of seniors over 60 here in the United States. If you're new to this channel, this is a safe space where we talk openly about the health challenges seniors face, and most importantly, the practical steps you can take to live a longer, healthier, and happier life. Today, we are diving into a topic that affects millions of seniors across the country, often silently, often painfully: sleep problems after 60. If you've been lying awake at night, tossing and turning, or waking up feeling like you barely slept, you are not alone. In fact, according to the National Institute on Aging, nearly half of seniors over 60 report experiencing regular sleep issues such as insomnia, frequent nighttime awakenings, or unrefreshing sleep. And here's the scary part: poor sleep is not just about feeling tired the next day. It can affect your memory, heart health, immune system, and even your risk of falls. But here's the good news: there are proven, safe, and effective ways to improve your sleep after 60, without always relying on sleeping pills. And that's exactly what we'll talk about in this video. So stay with me, because your nights of peaceful, restorative sleep may be closer than you think. Why sleep changes after 60? Let's begin with the big question: why does sleep get harder as we age? Many seniors tell me, "Doctor, I never had trouble sleeping in my younger years. But now I'm up at 3 a.m. staring at the ceiling." This is not your imagination. Sleep changes with age for several reasons. 1. Changes in circadian rhythm. Your body's natural clock that tells you when to sleep and when to wake becomes less sharp after 60. This can lead to earlier bedtimes and earlier wake-ups, but also more fragmented sleep. 2. Medical conditions. Seniors often deal with chronic illnesses such as arthritis, diabetes, heart disease, or lung conditions. These can cause discomfort, pain, or breathing issues that interrupt sleep. 3. Medications. Did you know that over 50% of seniors take more than 3 medications daily? Some of these, such as blood pressure pills, antidepressants, or even decongestants, can directly interfere with sleep. 4. Hormonal changes. As we age, the body produces less melatonin, the hormone that helps regulate sleep. This makes falling asleep and staying asleep more difficult. 5. Stress and anxiety. Retirement, financial concerns, health worries, or even loneliness can weigh heavily on the mind, making restful sleep hard to achieve. So if you've been wondering why sleep isn't as easy as it once was, these are some of the main culprits. The health risks of poor sleep in seniors. Now let's talk about why poor sleep is not something to brush off. It is not just about feeling tired. The consequences of chronic insomnia or poor sleep after 60 can be very serious. 1. Memory decline and dementia risk. Studies show that poor sleep may increase the buildup of harmful proteins in the brain, such as beta amyloid, which are linked to Alzheimer's disease. Seniors who don't get enough deep sleep are at higher risk of memory decline. 2. Weakened immune system. Your body repairs and strengthens its immune system during deep sleep. Without it, you're more vulnerable to infections like pneumonia or the flu. 3. Increased risk of falls and accidents. Poor sleep leads to poor balance, slower reaction times, and daytime drowsiness. For seniors, this means a higher risk of dangerous falls. 4. Heart and blood pressure issues. Sleep helps regulate blood pressure and heart function. Chronic insomnia is linked to high blood pressure, irregular heartbeat, and even stroke. 5. Mood and mental health. Poor sleep increases the risk of depression, irritability, and feelings of loneliness. Seniors often tell me they feel like they're losing themselves when their nights are restless. As you can see, this is more than just about being tired. Sleep is a cornerstone of health, especially after 60. Safe solutions. How seniors can improve sleep without misusing medications. Many seniors are tempted to reach for sleeping pills. While these can sometimes help in the short term, long-term use is risky. Sleep medications in seniors are linked to confusion, grogginess, falls, and even memory issues. So what can you do instead? Let's go through proven, safe methods that help restore sleep. 1. creating the perfect sleep environment. Cool, dark, and quiet, your bedroom should be a sanctuary. Seniors often benefit from slightly cooler temperatures, blackout curtains, and white noise machines. Comfortable mattress and pillows. A mattress older than 8 to 10 years can cause body pain and poor sleep. Consider upgrading to one designed for pressure relief. No TV or phone in bed. The light from screens suppresses melatonin production and tells your brain to stay awake. 2. Developing a consistent sleep routine. Go to bed and wake up at the same time daily, even on weekends. Create a relaxing pre-bed ritual, a warm shower, light stretching, or soft music. Avoid long naps during the day, especially after 3 p.m. A short nap is fine, but too much daytime sleep will reduce nighttime sleep. 3. Nutrition and sleep. What you eat matters. Avoid caffeine afternoon. Even coffee in the afternoon can disrupt sleep at night. Limit alcohol. While it may make you drowsy, alcohol actually fragments sleep and prevents deep rest. Try sleep-friendly snacks, a banana with peanut butter, warm milk, or tart cherry juice, which naturally boosts melatonin. 4. Gentle exercise. Seniors who move during the day sleep better at night. Walking, yoga, or light stretching in the morning or afternoon helps regulate sleep. But avoid heavy workouts right before bedtime, as they can be too stimulating. 5. Managing stress and anxiety. This is a big one. Many seniors lie awake not because of pain, but because of worry. Try deep breathing exercises before bed. Practice mindfulness meditation, just focusing on your breath for a few minutes. Reading a calming book or listening to soft hymns or nature sounds can also help settle the mind. 6. Safe natural sleep aids. Some natural remedies may help, but always check with your doctor before trying them. Melatonin supplements. A small dose can sometimes help reset sleep cycles. Chamomile tea has calming properties that may ease sleep. Magnesium supports muscle relaxation and better sleep. When to talk to a doctor. If sleep problems persist more than 3 nights a week for several weeks, it's time to see a doctor. Conditions like sleep apnea, restless leg syndrome, or depression may be the underlying cause. Real stories from seniors. I once worked with a 72-year-old patient named Margaret. She came to me frustrated, saying, "Doctor, I'm awake at 2 a.m. every night. I just watched the clock." She thought she needed sleeping pills. Final thoughts. If you are over 60 and struggling with poor sleep, know this: you are not alone, and there is hope. Sleep is not a luxury, it is a necessity for your brain, your body, and your spirit. Small, consistent changes in your routine, your environment, and your mindset can transform your nights. And with better nights come brighter, healthier days. So tonight, when you lay down, remember this: you deserve peace, rest, and healing. And with the right steps, restful sleep can be yours again. Thank you for spending this time with me, and may tonight be the start of your best sleep.